Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
Had some very interesting articles in the Washington Post this Monday. One of them was about what to do when anxiety strikes and you don't know what to do, and it went into detail on some of the tips that they thought were important. Uh, one one of the first things they talk about is the breathing, inhaling and exhaling. With those of you who do yoga would be very familiar with it. They say you should inhale for a count of four, exhale for a count of eight, and the longer you exhale, the better off you are. This is one of the first things they suggest. The second thing they suggest is something I guess we haven't discussed in a long time is temperature shift. I remember Darryl talked about how he used to take cold showers after his marathon and how that seemed to help him. And they talk also about how cold water has a positive impact on uh, slowing down the heart rate and decreasing anxiety. So those of you who are the cold shower enthusiasts, that cold water does do something good for you, especially those who can stand those cold showers. Then the third thing they mention is relaxing your eyes and widen your gaze so that you don't get so concentrated on what's making you so anxious, and you kind of put that into the back seat and really think about other things rather than focusing on whatever's causing you to be anxious. And then they say the next thing to do is to eliminate anxious thoughts, but uh, start thinking about other things. Um, Making a phone call, attending some special event, speaking up about something, and often uh, the anxiety will take a back seat to whatever else you're thinking about. And it's good to then think about everything other than the source of the anxiety. Um, uh, and then the next thing they talk about is uh, start thinking about becoming calmer and uh, instead of worrying about being anxious and disappointed, uh, uh, try to think about, well, what's the resolution of the problem? And why think about why you're so anxious about the issue, and whether it's because you're disappointed, you're embarrassed, lonely, or you're afraid of failure. And then they say after that, turn towards the feeling rather than to escape or suppress them. How do I make this go away? How can I help myself so that you uh, focus on the solution to the anxiety causing problem rather than giving into the anxiousness. And then they say that the next thing to do is not be so judgmental about uh, whatever is troubling you and what you're guilty of and what you have been guilty of and why you deserve whatever is happening to you, and uh, stop with the judgmental and shaming yourself and try to think more positively. Uh, and then one of the last thing they talk about is uh, answering and doing other things like answering your email, answering your phone, uh, uh, singing or practicing your instrument for 5 minutes, uh, sending a thoughtful text to somebody else to get it off your mind, and then, of course, mindfulness exercises, uh, uh, thinking about other things. Uh, Notice five things that you can feel, four things you can touch, three things you can hear, something you can smell, and something you can taste. So you can focus on other things. And then after all is said and done, focus on uh, the present and what you're going to do to move from being anxious to being calm. And so anxiety, of course, is one of the anxiety and depression are the commonest mental concerns. And so this is something that is very common. And so this article talks about all of these different ways of handling anxiety. And I think all of us have been through this and have experimented in ways. Maybe you might want to share some of the tips that you use to help when you get anxious about something, when you get depressed. Any thoughts or comments you want to share with us about how you handle anxiety?
I got one, and that's kind of simple. Like they say, let a smile be your umbrella. You can't be too upset if you're smiling. What you mentioned
Okay.
about doing something with your eyes, I do this technique of like when you relax your focus, you see things double, and that helps relax your mind. Just let your eyes go out of focus, and everything is double.
Any other tips you want to share? Anybody else?
Where am I? I didn't punch. For me, it's cleaning. When I want to relax, I would do things around the house and clean. And when I get tired of that, if I still feel anxious, I have work being done here, so I have to get off. But if I still feel a little anxious, I talk on the telephone. I have a couple of good girlfriends. Talk about grandkids, talk about the weather, and it just changes your focus. That's what I do when I feel anxious. The main thing is find something to clean around the house.
Okay. Any other things you want to share before we go to the next topic? Um, this is an interesting article they have about how getting married can help you influence your cancer risk, your mental health, and cardiovascular diseases. They look at the rate of successful marriages and the incidence of hypertension, cardiovascular disease, and cancer as well. And they identify that those who are happily married seem to have less problem with their health. Uh, However, those who are unhappily married have more problems with their health. So, so they're not recommending that you stay necessarily with a bad marriage, but they say having a good marriage can help you, can help your health, your mental health, your cancer risk, and cardiovascular diseases. So making the right choice and finding the partner for yourself that uh, uh, is good for you is good for your health as well. Uh, I say that people who are married live longer than people who aren't married. So any comments about that? Those of you who are married or have been married, what are your thoughts about how saying I do affects your health, mental and otherwise.
It's a
No
good thing.
comments?
It's a good morning, everyone. It's a good thing that I got out of that first marriage because I probably wouldn't be here. But the second one has worked out well.
Very well.
But you heard my husband say very well, yeah, because he. But that first one wasn't too good. I was young. I guess I didn't pick right. But second one has worked out 36 years right now so far.
Amen. Amen.
Any other shares? If not, the last one is an article about taking care of your mouth and teeth and how not taking care of your mouth and teeth can really cause all kinds of problems, not only your mouth, but also your heart, and uh, how that once a year you should go to see your dentist, and that more than 20% of people have cavities that they don't take care of, and 70% of people are afraid of going to the dentist, and that diabetes, oral infections, heart problems, all can be worsened by not having good dental care. Uh, how many of you are afraid to go to the dentist? Yeah. How many of you actually see the dentist at least once a year? Yeah, and uh, it's amazing that some of the obvious things they say is brush your teeth twice a day with a fluoride toothpaste. Uh, clean between your teeth at least once a day with floss. Drink plenty of water. Choose sugar-free. Um, cut back on added sugar to uh, sodas, cereal, candy, and baked goods. Limit snacking and uh, wait 30 to 60 minutes after eating to brush your teeth. Uh, so these are just some of the things that we should be sure about as we remember that sometimes the way to our hearts, brains, and other parts of our bodies are through our teeth. And many people die from mouth infections that cause heart disease. So anyway, just thought I'd share some of those things with you because oral and dental care is an important part of your health. Any other comments or questions about that? By the way, I did talk to Patty DeLone yesterday, and she said she's feeling much better. She's now about 5 weeks after her open heart surgery, and she's getting better every day. She's getting physical therapy and everything else. So it's good to hear from her. Okay, guess we can start the articles now if there's aren't any other comments. Oh, this of course is very appropriate for us because we in this session we sit for almost an hour and a half sometimes, and so sitting is a problem. Of course, they say that those who have jobs that require them to sit for more than 8 hours have more cancer, diabetes, heart disease, and other illnesses. And sitting is likened to smoking in terms of the danger. Of course, it doesn't isn't it's not quite as dangerous as smoking, but it is dangerous. And the diabetes, the blood sugar and cholesterol levels, as well as the poor blood circulation, uh, and also the increasing the brain dysfunction, as well as rates of anxiety and depression. And they talk about the fact that exercise alone is not good enough, to overcome the bad effects of sitting down for 8 hours. And so uh, exercising regularly, which we talk about forever, 30 minutes, 5 days a week, walking and taking movement breaks every 5 to 10 minutes, meaning you can walk and talk and uh, chat, do other things to keep your body moving. Uh, uh, for those people who are actually required to sit down, and then they have to try to get up anyway and talk face to face. Instead of texting, call somebody and talk to them. Talk about using a standing desk as a possible alternative, and using a Fitbit or watch can be programmed to remind you to remove. And not we don't talk too much about compression stockings, but I wear them, and they can promote circulation in your legs as well as pedal exercises, moving your foot and ankle back and forth for 100 times an hour is something that increases the circulation and prevent those blood clots that can actually go to your lung and kill you. So that just a reminder that the sitting is dangerous and that you can avoid many of the complications of sitting by moving around. And the more you move, the better off you are. The less you move, the less healthy you are. Any comments or thoughts about sitting?
Yes, Dr. Callender, I had a comment. My stepbrother was a Lyft driver and an Uber driver, and he did that all the time. I mean, he would, you know, so that's kind of like sitting
Yeah,
all day.
yeah,
And he got blood clots,
yeah,
and it killed him.
yeah.
And he was not that old. He was like 60. And so I mean it's something to really think about.
And if
That
you
that
take a
standing
mhm. If you take a
that
long plane ride and you have to keep reminding yourself to pedal exercises and get up and walk around, because if you fly up more than an hour long, then your circulation is compromised, just as you mentioned. Uh, Darryl, I saw your hand.
Yeah, I took my hand down because I was going to talk about the Lyft and Uber drivers, just like John did, because a lot of our grandkids, they're working. Well, our grandkids now are in their 40s and 50s, some 60s, and they work full time jobs where they sit down all day. Then they go out and work a 4 or 6 hour shift as a Lyft or Uber driver, still sitting down. And we need to tell them about the risk. They need to find another part-time gig other than something that's just more sitting down.
Betty?
Yes. Is staying in the bed just as bad as sitting?
No, staying in the bed is much better because your legs are elevated and your circulation is better.
Okay.
Janice?
Yes, I have varicose veins, and periodically I can tell when my legs are tired or if my veins are being affected as we speak. I said, today is the day that I need to put my um, compression stockings on. And of course, he said, oh, it's summertime. Well, sometimes we got to do what we got to do. And, but I did put them on this morning, and it does help. It makes my legs feel so much better.
Yeah. Thank you. John
Mhm.
Buchanan?
couple of things. What is the TED hose? What does that mean?
That's just this, that's what compression stockings are. They're
Mhm.
called thromboembolic. device, which is another name for compression stockings.
Mhm.
Okay. Uh, let's see. And as far as well, I'll get back to it. I forgot what I was going to ask. Okay, thank you.
Okay. All right. I think if there are no more questions, I think we've dealt with an issue that I think is very important. As Darryl pointed out, many of our children, grandchildren, great grandchildren uh, sit far too long, and it's dangerous. Yeah. I think I recall a young lady who was on an airplane for 2 hours, and she got a pulmonary embolus and died. She was in her 20s. Yeah. So
Yeah, so that was my question, Dr. Callender. Um, I have in the last 2 years now, when I'm flying, I've it's very expensive, but I'd rather fly business class or first class where I can stretch my legs out because some of these airplanes, I mean, you're like squinched up and your legs are like right up underneath you for 2 or 3 hours. And I mean, I did a 15-hour flight and a 16-hour flight 3 years ago to the Philippines. I would have died right on that plane if I had to be in regular seating at those times. So even though it's more expensive, I feel so much better being able to stretch my legs out on those flights. Thanks.
right, and you see some people who walk around on the airplane all the time because they know that sitting in one place all the time is unhealthy. Yeah. So you use good judgment. Darryl?
Yeah, the other risk we haven't talked about is computer video games. Our kids call themselves being gamers, and they sit for hours at a time. I mean, they can do 8, 10 hours doing these video games, getting a high score, and their parents and grandparents are the enablers because we buy this stuff for them. That's going to eventually kill them.
Joyce? Joyce?
Question. Even if you're not having problems with your legs and and its circulation, is it a good idea to wear the compression stockings, especially if you're going taking a long airplane ride or a car ride
Absolutely.
or just
Yeah, I think it's almost mandatory. Yeah. And also do pedal exercises as well, in addition to the compression. We call them TED stockings, but they're compression stockings, and they're easy to obtain. So it's worth it. Yes.
Hmm, thank you.
Okay. Janice again?
Yes, just in answer to Joyce's question, my doctor prescribed the knee-high compression stockings. It takes a little energy to put them on, and I may not keep them on all day today, but if you're having problems with your legs, as I do, when you put those stockings on, it's a big difference. Your legs feel more relaxed, but the knee
Yeah.
highs easier to get on, and try it. Yeah, and definitely I wear them on a plane.
When we talk about compression stockings, we are talking about knee-high compression stockings, just as you
Oh,
mentioned.
thank you.
Mhm.
Okay, well, let's go to the next article. Oh, no. Well, the impact of the new administration and getting rid of USAID is being felt all over the globe. And it's thought that this is one of the first tragedies of the Ebola uh, pandemic that has killed hundreds of people so far. The fact that we've cut out aid to many uh, countries, particularly in Africa. And of course, this Ebola crisis is occurring
Yes.
in Africa. And one of the contributors to it, in spite of the fact that the administration says that that's not the case, it is the case, and that the absence of the of USAID is one of the reasons why the response to Ebola has resulted in the deaths of so many people. So um, there's so many manifestations of this new administration in terms of saving dollars in one place and losing in another place. And so tragically, this is one of the prices we pay, and probably going to pay many more prices in terms of people dying because of we are no longer helping people outside the United States like we used to. Any comments or any people you know in Africa who have recognized the difference between how USAID used to be and how it is now? Okay, no comments. All right.
I had a comment, Dr. Callender. What is the USAID? What is that?
Oh, that's Agency for International Defense. And USAID was in all across the globe, particularly in Africa. And many of the health issues were taken care of by, particularly involving healthcare for people who didn't have funds, was provided by the United States Agency for International Development, which is AID. And that's the program that Trump has just about eliminated all across the world, especially though in Africa. Yeah. I know when
And
I was doing my 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 missionary work early on, AID was the mechanism by which many of the health issues were addressed.
so I think people gave Barack Obama credit for working on that Ebola response early on. I guess that was almost 10 years ago now. And
Yeah.
with the research, they were able to lock it down. But this is a variant of that Ebola strain, and without that focus, to hurry up and get a um, mRNA vaccine against it. And what was on the screen just now said that even after those people die, they can still spread the Ebola after they're dead. It's it's very, very scary. Um, and the last thing I'll say is that Ebola is easy to trace because hours after you get it, you're dead. So they can follow the pattern of the disease very, very quickly, very accurately. But without the money and the focus to treat it, um, you know, it could be coming here.
Yep. And I think it was last week that we pointed out that those people coming from Africa had to stop off at Dulles to get screened before they allowed to come back to the United States. So, okay, let's go to the next article. We regret that our administration no longer considers itself a global uh, concern. We're getting back to the point where we used to be, where we concerned about America only, which is unfortunate because we're all part of the global scheme, whether we like it or not. This is an interesting article that talks about AI and how having a focus on uh, AI and having people who actually take notes for the doctor so the doctor can spend more time with the patient makes a big difference. Uh, and over time, we now have a situation where doctors are spending much more time with the patients, and they have people who actually take care of the medical record for them so they don't spend so much time looking at the computer and less time looking at the patient. And I think this is something that is important to do. And I think we're getting to the point now where the many of the practices will have people who will actually take care of the computer stuff while the doctor actually does what the doctor's supposed to do, which is examining the patient and getting a good history and physical. And this is something that we need more of rather than less of. Also, we need to, uh, right now, there's so much emphasis on the time you spend with the patient that uh, uh, many times the doctor feels that if he spends more than 10 minutes with the patient, he's criticized and punished. Uh, and this has been a concern that is particularly important in the mental health arena, where taking time to listen to the patient's concerns is a critical part of all of their management. And this article talks particularly about mental health issues and uh, needing more time for the doctor to spend with the patient. And sometimes AI may help so that the doctor can focus on that patient interaction rather than spending so much time on the computer. Yeah. Any comments about that? Yeah. Betty Blaylock?
Well, it hadn't gotten down to my doctor yet because she's still on the computer. She's still on the
Yeah, well, we've got to work on that. Dr. Brass?
I've had several medical visits recently, and it definitely has improved my interaction with my physicians. Having someone who's taking care of the medical record. It's been a long time coming, but uh, I definitely felt. Uh, More important during the visit, having, direct eye contact, and, uh, I just felt that my physician was more locked into me. And I really appreciated it.
Hmm. Thank you for sharing, John Buchanan.
Yes, I also had uh, observed my doctors. They can really type fast and don't even look at their fingers. I mean, they're really good at taking notes and asking questions while they're, putting this information into the computer. And I mean, I go to Kaiser, I get a complete uh, uh, version of what happened during the visit and also any suggestions. I mean, it's like sometimes 2 or 3 pages of notes that the doctor has taken. Uh, so yeah, having somebody else to do that, I don't know if they would be, as well versed to handle everything that the doctor puts in there. You know, thanks.
Well, they should be because they actually get paid to do that. And it's almost like a science now that these people have. Their job is to take all of the information down so that the doctor has it when he reviews it. It can be complete, and they really take great lengths to ensure that they do it completely. Um, any other comments? Because this is kind of a work in progress. So, okay, let's go to the next article. This is something that has come up, the AI. One of the things that has been in the literature recently is the fact that the chat bots and boxes are sometimes not giving adequate guidance to patients, sometimes giving them incomplete and sometimes uh, in, inaccurate information. And so it becomes critical that we make the AI better than it is now so that our patients are guided appropriately because, as you recall, one of the most recent articles said 50% of the responses were inadequate and inaccurate. And so I think what it means is that we've got to do better with AI and make it more accurate and more appropriate. And so I hope that with time and with more community involvement, that that will no longer be the case. But right now, it is still at a point where it is not as helpful as it is going to be in the next 10 years, I imagine. Any comments about the AI and the role it is now playing in the management of many diseases, especially with cancer, when people want to get additional information? And I think the one thing that is maybe missing is to use the AI alone without uh, using the physician as well, so that you don't have an incomplete story, but have a story that is balanced by the physician's interpretation as well of the information you get from the AI. Any comments on it, on this process, which I think in the long run will become invaluable to doctors and patients alike? Okay, and I think one of the things that's imperative as well is to increase the health literacy of our patients as well as uh, because if they are more educated and informed, they would also know that they need to also get the physician's input as well as the chatbot. John Buchanan.
Yes, because of fear of seeing the doctor, I've heard more and more recently that some people are totally using chatbots to direct how they're going to live their lives. They go straight to the chatbot and ask for advice, and then they follow that. And they, I mean, if you're afraid of going to the doctor, you know, you might be more willing to do a chatbot. I think that's probably dangerous. I don't know. What do you think?
It's dangerous. Yeah, you have to have that balance, especially right now when the chatbot information is inaccurate in 50% of the cases. So that's dangerous. Yeah. Dr. Perez?
One of the things I have not experienced with my multiple recent visits is the interaction with physicians in training. And I appreciated and have become more comfortable having somebody else in the room when I'm having the exam, as it relates to the person who's taking care of the medical record. But I have not had a student. And I wonder, I know, Dr. Callender, you at Howard, how you feel that the medical note taker, so to speak, that interaction with physicians in training and fellows, how that works.
Well, in many ways, the person who's doing the AI is uh, somebody who's a potential medical student. But I think what you're referring to is somebody who's a resident or uh, somebody who uh, and I think in many ways that uh, person who's doing the medical records has replaced that person often, and that's not good either because they need to be trained uh, as well. And so, how we interact with the note taker as well as the resident, uh, to me, that's an important part of it that needs to be included. And if we've not worked it out, we need to, because that person who is missing the resident is going to be the attending of tomorrow, and they need to know how to use the note taker as well as the attending.
I know it was an important component of my training. Um,
Yeah,
being the first one
yeah,
to ask the
yeah,
questions, to get the history, to
right.
and especially in the realm of disparities and bias. Uh, I think I added a different flavor to the conversation. Um, and I hope that, you know, we don't lose that very
We can't
important.
afford to lose it.
Yes,
You're
we
right. We
can.
can't afford to lose it. So I'm glad you brought that up. So yeah. Okay. Let's go to the next article then. There's no more comment. This is an article that was kind of horrifying. As a uh, child of a mother who died giving birth to me and my twin brother, uh, to have somebody talking about free birth, which means that they have no uh, previous care by anybody from the time they get pregnant to the time they deliver, is kind of horrifying to me. And we still have mothers dying, as you know. Our maternal mortality rates are among the highest in the world. And so I think to have a situation that free birth is considered as desirable is just inhumane. So, but that's what this article is talking about. And they're talking about free birth. They're talking about uh, from the time you get pregnant to the time you deliver, not having any uh, preparation, which of course is undesirable and unacceptable. Uh, and I don't know if any of you uh, have ever encountered anybody who has decided they want to have this so-called free birth, but it's not good for the child or the mother. Any comments about this so-called natural birth? Betty
Doc,
Blaylock?
does the free birth include not even going to the hospital when it's time to give birth?
Well, it includes free birth means that you can do that at home as well, yeah.
Yeah.
But there are variations on the theme. Some people will go to the hospital for birth, but that's far too late.
Yeah. Mhm. If they want to be free, they need to take it all away. If that's their claim. But
Well, I think they need not to be free.
I agree. I agree. I agree.
Because it's in their best interest as well as the child's best interest. Yes, John Buchanan?
Yeah, so that means they're not getting any vaccinations at all. They're not getting treated to protect the child or the mother at all. Nothing.
That's correct.
I think that's sick. Sorry about that.
Yeah, I think. Yeah. Dr. Brass?
It was an unfortunate outcome in many of the adolescent pregnancies that I was involved in. That, the desire to keep the pregnancy quiet, nobody to know about it, the fear,
Yeah, yeah,
and it was really disastrous.
yeah.
And
We lost classmates. Yeah,
yeah,
yeah.
but not only for the child being born, but maternal mortality.
Yes, absolutely. That's right. That's what was most horrifying about it. Yeah. Okay. Um, let's go to the next article. This is a fearful one. Now, this is an article that uh, rarely ever talk about the clitoris. And there are many places in the globe that they have clitorectomies because they don't want the women to have sexual desires, so they take off the clitoris. But the clitoris is the source of the much of the sexual satisfaction in the woman, and so it wasn't until recently that the clitoris had the same uh, efforts of understanding it as we did understanding of the penis. And so now we have a better understanding now of the clitoris, and so we recognize that uh, the clitorectomists are not desirable, but still there's still countries where female genital mutilation is the state of the art. Um, and I think that this is opening the door so women can have their sexual issues addressed just like men have had their sexual issues addressed regarding the penile health. But up until 1998, that was not even part of the issue. That is now. And so that's a step forward. As Dr. Perez often talks about DEI and how we're going backwards rather than forward. And so this is something that we need to do more of. Hey, I'm in a meeting. I'm going to call you back later, okay? Yeah. So anyway, that's any comments about this gender bias, which has been forever in the field of medicine and is now because of up until the new administration, which is not interested in DEI, this has come to the forefront. it is likely that this will decrease as a consequence of the new administration. Yeah. John Buchanan?
Yes, what countries are you aware of where that mutilation or
In Africa,
elimination takes place?
I know in Africa it was very common. I don't know about Asia, uh, but in Africa it was very common for women to have clitorectomies so that they would stay faithful to their husbands.
Hmm. Any countries in particular?
I don't know which African countries that was most common in. I don't know if anybody else is aware of the countries that still uh, have clitorectomy as part of the preparation for women. And I think it's kind of been a topic that is not really discussed in public. And that's why you don't have a good answer to your question, which is a very important question. What countries are still doing it and why they're still doing it? And of course, we know why they're still doing it, but whether they should still be allowed to do it is the question. Dr. Perez, any comments or thoughts?
It is, I don't know specifically what countries. I know it was associated with a lot of, I don't want to take a religious group, but a lot of Muslim um, countries. And the female mutilation was a major issue as it related to the UN and NGOs and the protection of women from that standpoint. And the fact that it was occurring to very young women because these are women who enter into marriage at a very early age. And I know it was a big issue as it related to HIV disease in sub Saharan Africa because it was a belief that the younger the woman was, the less likely she had been exposed to the virus. And so female mutilation, early marriage, and these were marriages in which polygamy was a major component. So a man could have many wives. It isn't something that we've heard a lot about recently. But to the best of my knowledge, in many of these countries, nothing much has changed.
Yeah, as a matter of fact, this is one of the rare articles that you'll have on this subject. And so it's an, it's interesting that this bias is still remains, although it's not nearly as uh, evident as it used to be. Okay, if there's no more comment, we can move on to the next article. This is an article that talks about the fact that people who have anxiety and who are pregnant need to continue to take their medicines, and that autism and ADHD are now not a risk. That all of the data now indicate that the antidepressants do not cause autism nor do they cause ADHD in children. And so as a consequence, it is encouraged that the pregnant women who are depressed, that they continue to take their medication because postpartum depression remains to be a concern and an issue that requires serious treatment. Any comments about this? I think we had an article about this last week, and um, to dispel the concern. Dr. Perez?
I think as this group is doing, it's important not only for the mother, but for the family. Because during postpartum component, family support is crucial. And being aware, I think Serena Williams and some quote unquote celebrities that have been open about their postpartum depression has opened the door for the community responsibility for bringing our children and our mothers through this postpartum period with a lot of support. I know we're trying to talk it up at in church to make sure that those months and having this wonderful grandchild that I have and being able to be with him for the first 5 weeks of his life was invaluable to me. And I could just see how worn out my daughter and son-in-law were just with this wonderful Leonard that we have now.
Thank you very much. Any other comments? If not, we'll go to the next article. This is another article that talks about the adverse pregnancy outcomes related to the poor health of the mothers and their heart conditions. And I think this is another situation in which the health of the mother impacts the health of the child, and particularly as it relates to the cardiovascular health. And if the mothers are not getting appropriate prenatal care, then this makes it even worse. So, and of course, as Darryl has mentioned oftentimes, I know he's had to leave. Obesity is among the other issues, high BMIs that correlates also with the maternal hypertension and maternal health. And they emphasize that heart healthy behaviors start in childhood. And so by the time you get pregnant or have a child, the die is already cast. And so as I mentioned many times ago, that for example, hypertension probably needs to be monitored after the age of 12. But if you wait until the teenagers, it's caught later on, and it's going to reflect itself in the health of the child as well. So one of the things that it points out is that the information we're sharing here is the kind of information that needs to be shared at a much younger age level than the 12, 13, 14, 15, 16. They need to be shared this information, not just the older people, because by the time they have already developed unhealthy health habits that will affect them and their children. John Buchanan and then Dr. Perez.
Yeah, this is a direct response to that free birth crap,
Yeah, right.
That directly addresses that
Yep.
situation.
Yes, it does. Yeah. Dr. Perez?
And I think it's also important as we relate to our first approach to HPV vaccination was to have the conversation with parents about their preteens that were going to be sexually active. And that was a hard pill to swallow.
Yeah.
That your little 8 or 9 year old needed to be protected from sexual activity. But I think now with everything that we see, we are just so wide open as it relates to sex, and that the conversation needs to be an elementary school conversation. And I have noticed that even when we talk about alternative sexual practices with gay and transgender youth, that it pushes them into sexual activity without any basis for the discussion. So I think it is important for us as a society to be open and more direct about sex, almost from the crib. Uh, we've got to change.
So true, so true. John Buchanan?
Yeah, also, those kids know how to use AI and chatbots.
You're right
Yep.
about that. And if the
Yep.
information is incorrect,
Right. Yeah. Okay. Well, I think those are very good points that we need to keep in mind. And so the question is, how do we get our great-grandchildren, grandchildren, and our children to be aware of these issues as early as possible? And the question is, who talks to our kids about their sexual practices? Or does anyone talk to the children about their sexual practices? Or are they just off-label discussions that nobody talks about, and therefore they are ignorant of the uh, uh, ignorant only because they get talked about it off-label and not actually from a source that is ideal, because the schools would be the best place for it to be done. But, any other comments? You teachers have any thoughts about that? Dr. Press?
I'm glad you said you teachers, because we have really put lots of halt in how it is taken care of in school education. So it's a super hot topic that many schools don't even want to touch, let alone be open with the conversation. So I think in this arena, we've gone backwards instead of forward.
What about the church's role in this? Do they have a role in this?
Absolutely. But here is what did God say to Joshua? Be strong and very courageous. Our churches have to be strong and very courageous.
Yeah. Are they? Are
I
they?
don't think so. I don't see it.
I haven't seen it yet, so uh, I haven't seen any discussion of sex in church at all. John Buchanan.
The physical education teachers, um, you know, have had some training in this arena, but the regular teachers, English and math and science maybe, may not have had this kind of they need training. You know, the teachers need uh, just like we had to have training about grief and how to handle grieving. We because the ground has changed. The platform is different. These kids in high school are just openly, bisexual or it's 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 not uh, taboo anymore to be wide open with those relationships nowadays. So, and several years ago, when I retired from teaching, a lot of the teachers couldn't handle it because they didn't have the information. So I think it starts with teacher education. Thanks.
Well, interestingly, I forgot to mention that next week, my daughter, Lena Callender, will be talking about the female concerns, LBGYN issues that relate to people, to women over 50. Oh, Betty Blaylock?
Yes. Just thinking about that sex talk. I I remember when I was growing up, my parents, they never said anything. They were older parents, but I guess they weren't taught to say anything, so they didn't say anything. I don't know about whether they said it to my sister. No, they never said it to me. But my first person that talked to me about sexual things was my sixth grade teacher. And back then in the 50s, I don't know whether they had any mandates whether you should or shouldn't, but he was quite open in our classroom and he explained it, you know, to us in detail and talked to us about it. But when it came time for me to talk to my children, really before I could talk to them, they asked. So I didn't
That's
have
very
any,
interesting because
I
I
didn't
know,
have any, I had to talk to them once they asked me about it.
yeah,
But before I,
because uh,
yeah,
I know that when I grew up, that it was nobody talked about it in school or in church. So the only place you could talk about is with your peers
yes.
who knew nothing anyway. And so you
No,
was it was bad. It
yeah,
was bad.
church was never a part of it. Church was never a
Never.
part
Never.
of it.
No.
Never a part of it. I've been in church all my life, but it's never been a part of it. Yeah.
And it's
Yeah.
all in the Bible. You
Yeah,
know,
but
all
yeah,
the
it's in the Bible, but
relationships. Yeah, but we kind of don't add the sex to it. I mean, there was a whole lot of stuff happening that my Sunday
um,
school teachers, my Sunday school teachers never picked up on it. Even David, King David, and
well,
Bathsheba. I mean, all that stuff.
look about Shem, Ham,
I,
and
yeah,
and way back.
Absolutely.
way back then.
Yeah.
I was a Sunday school teacher and I never talked about it.
Yeah, the first issue with him and his father, and none of that stuff is ever. It's funny how we talk about everything else, but that never is addressed.
But
So,
even now, I'm in my 70s. I can't picture my parents who had sex 3 times, only 3 times. Me and my two brothers, they only had it 3 times. I still can't even, I can't even visualize.
Well, well, if we have this kind of discussion, uh, what's going on with our kids, and uh, this is an interesting topic we've brought up, and the question is how we're going to change things for the kids who are 6, 7, and 8 today. How do you teachers see it as a, as John had mentioned, the there's certain teachers who may be able to do it, but many of the others, it's foreign to them. But it's an issue that the churches as well as the schools need to consider as an important aspect of education. Sex education. Okay, any other comments about this? We'll go on to the next article. Oh, Betty Blair.
Yes, I do. I said the churches didn't do anything about it, but I remember one time our Christian education leader asked me, I was a young parent, asked me to talk to the girls in the church about contraceptives. And I did do a class about that, but I didn't go into any detail about what I just told them the different types of contraceptives that were available to them. And I think
Interesting.
I mentioned to them that I was a young parent and you know, and had was pregnant young. And so these are the things that will keep you from getting pregnant young. But I didn't really go into depth about any of the other sexual stuff. I was just telling them what would happen, how to keep from, you know,
Uh-huh.
yeah. That's the only thing my church did.
Interesting. Interesting. Okay, any other comments? Sounds like it's still an issue. Okay, let's go to
We
the
have
next
to
one.
do it like we do family history. Maybe, Dr. Dorothy Irene Height talked about um, these kind of conversations at our family reunions. And, you know, uh, as I'm thinking about it, I find it hard to conceive of having a sexual conversation with my aunts and uncles, but I think we got to get there.
Yeah, I agree with you. I agree with you. Yeah. Hmm. Okay, let's go to the next article. Now, this is interesting. This will be the next article because what this is talking about is uh, the fact that for people who are in menopausal age, the doctors aren't even asking about their sexual interactions. And we talk about menopause uh, here and hormone therapy being underutilized because of the concerns about estrogen and progesterone and cardiovascular blood pressure uh, because of heart attack and estrogens. And we talk about the blood clot concerns. We talk about, but we don't talk a lot about uh, the sexual activity of the people who are in the menopause. And we do talk about the cancer associated with the hormonal, and of course, there's a lot of evidence that that is no longer a concern. But still, for the menopausal woman, one of the areas that we talk little about is the sex, and that comes up later, sexual activity of the menopausal woman, and whether they're having a lot of sex no sex or little sex. Dr. Press?
I just wanted to add in there menopause of men, as we find out we're beginning with DEI to focus in on as well. And maybe some of the adverse relationships and adverse actions that we're finding in men during the menopausal point might come from miseducation.
Well, what frightens me is all of the young men who are dropping dead, who are spending most of their time taking testosterone and other medications to build up their muscles. And some of them are resulting in having heart trouble, and some are dropping dead. And so it's a concern for the men, and of course the advertisements about the use of testosterone. You can't turn on any of the sports programs without encountering them. But they don't talk about the hazards of taking these kinds of medications to the extreme, and the price that some people are paying, because we're having more younger people who are dropping dead because of the inappropriate use of these muscle building issues. And uh, one of the issues about the menopausal is the issue of the libido, and whether in men they take testosterone. Do we do the same thing for women? And do we even ask them about their sexual activity after during the menopause or after? And so this is a concern that many of the OBGYN people are concerned, because we don't really talk about that with our women. Dr. Perez?
And what is, it's like when you say libido, what is normal? Is it like drinking? Are you an alcoholic if you drink more than I do? Or um, what we don't talk enough about it. We were talking about clitorectomies and things of that nature. We don't talk about arousal. We don't talk about climaxing. We don't talk about what is a normal libido. How often should you, at certain ages, engage in sexual intercourse? It's a conversation that I think we obviously need more of.
And I think that's what these articles are suggesting, that this is not forbidden topics. These are topics that everybody should be addressing, but the uh, obstetrician may not be, the gynecologist may not be addressing it, and the primary care doctor may not be addressing it. And it seems as though that we need to do more rather than less of this. And I think your point is well taken. How do we get to that? Well, it's interesting to talk about it here. The question is, how do we move from here to getting to the point where we talk about sexual relations, sexual intercourse? Uh, any other comments about this? Because I think this is something uh, that we talk little about it at any age. At any age we talk. It's almost like it's taboo. Any other comments? We go to the next article. And this is again pointing out that we rarely actually have discussions about the sexual health of people, as Dr. Perez had mentioned. What is the normal? What is the abnormal? What is the expected of at each age? And I have encountered very few articles that actually talk about this, and it's just something that normal people do, but yet we tend not to want to talk about it. Uh, and who is the person that should be talking about it? Is it the doctor? Is it the urologist? Is it as we heard, um, the urologist talked 2 weeks ago about those issues. But is there anybody else who talks about it? Does the primary care doctor talk about it? So these articles are saying that we aren't really addressing sexual activity among the menopausals either. And when we do, what are we doing about it? And while we have drugs for the male who has decreased libido and inability to perform, do we have similar drugs for those women who uh, want to have sex but don't have sex for whatever reason? And so this is an area that we've got to reconsider and look at in terms, and I guess one of the things we can ask Dr. Callender next week is what are her recommendations as to how we should address these issues. Any other comments or questions about these interesting articles that open up areas like we never talk about masturbation, for example, male masturbation, female masturbation, those kind of things. Yeah. Probably the first time you hear somebody talk about uh, teenagers masturbating will be the first time because it's a subject that is almost never discussed. They
It
talk about
causes
male.
blindness.
Oh yeah, that's right. Yeah, I remember that's what they said. Yeah, so those are all issues that we've chosen not to even mention, and so in the future we're going to have to decide who's going to be talking about those subjects because those are subjects that are talked about, and because we don't talk about it doesn't mean they're not talked about. They're talked about it by people who don't know much about it, and that's the problem. Yeah. So let's go to the next article. And this will be the last article. Again, it talked about postpartum sexual violence. Once you have the baby, when do you have sex again? And uh, is it hard to do because you've had a C-section or you had a vaginal delivery and your vagina has been cut? And what about all those postpartum sexual problems? Are we addressing those issues? And if so, are you having pain? Again, the clitoris, has it been damaged? Has the vagina been damaged? You having a problem with dryness? Are you having painful sexual intercourse? These are issues that this article is pointing out that we're not really addressing like we ought to in women after they've had their babies and they've had anal sphincter issues. They've had damage to the vagina and other areas. So we don't have the answers, but these are issues that you can't sweep under the table. Well, we actually are sweeping under the table, but should we continue to do that? And uh, so as I get ready to close up, uh, just remember that next week, Dr. Elena Callan is going to talk to us about the gynecological problems of women who are 50 and above, but all ages of women still have sexual issues that we rarely ever discussed, particularly the postpartum woman who's suddenly had her baby and now she's ready to resume her sexual practices with her husband, but she can or can't she? And these are issues that we haven't discussed in the past and we need to talk about in the future. Okay, any other closing comments you need to have before we say goodbye to each other? Thank you for attending today. And Betty, you had your hand up?
Yes, I just wanted to say that after my first pregnancy, these things definitely were not discussed as to when you should begin having sex again, because 13 months later, I had my second baby.
Wow.
If
Yeah.
they had told me some things, maybe I wouldn't have started back quite so soon. Yeah.
Okay. All right. Well, God willing, see you next week. And Dr. Callan, tell your lady friends so they can hear more about gynecological problems that occur after the age of 50. Yeah. See you next week, God willing.
Thank you, Dr. Callender. Be safe, everyone.
Bye.
Yes, outstanding. Thank you.
You.
Have a great week, everyone. We'll see
All
you
right.
next week. Ciao.
Bye-bye.
Bye-bye. Thank you.